Hi, I'm Brandon Hayes-Lattin. I'm a medical oncologist at the Knight Cancer Institute in Portland, Oregon, but I also serve as the senior medical advisor here at LIVESTRONG. And today we're going to talk about HPV vaccines and the prevention of cervical cancer. So it turns out that the HPV vaccine is one of the tools we have that can actually prevent cancers, and it's highly effective. There are a couple of cancers for which not only are they directly caused by an infectious agent, a virus, like the human papillomavirus, but examples here where we have a vaccine that can prevent that infection and therefore completely prevent cancers related to that infection. So in terms of the risks and benefits of the vaccine, let me start with the benefits. Cervical cancer is quite often directly caused by the human papillomavirus, HPV, and in patients who are immunized and don't get that infection, that risk becomes none. So this is a cancer that can be deadly. There's about 250,000 Americans that have cervical cancer related to HPV, and we can completely prevent that with a simple vaccine. So I think the benefits are very strong. In addition to that, the vaccine can prevent other HPV-related cancers of the genital tract, so other female cancers, male penile cancer, anal cancers, but also cancers of the throat and tongue, sort of head and neck cancers that can be associated with HPV. All of these are cancers that can be completely prevented with a simple vaccine. In terms of the risks are extremely mild. The vaccine is given as a shot, an intramuscular injection, so as you can imagine, especially for a younger child, that can be painful and temporarily discomforting. In some patients, when their immune system reacts to the vaccine to do what it needs to do to create the immunity we want, there can be a little bit of inflammation, so people can get fevers. But those things are all very temporary, and compared to the benefits of completely preventing these cancers, the benefits far outweigh the risks. So the original recommendation for the vaccine Gardasil is to get 3 doses of the vaccine. And the reason for that is most vaccines that don't have a live virus, like this one, require a couple of exposures to first prime the immune system against what you're vaccinating and then build upon that. So the immune system not only is activated against the virus, but creates cells that will last a lifetime. There have been studies looking at, are 3 vaccines actually necessary? Can you get immune activation and long-lasting immunity with fewer? And there are some preliminary studies that suggest that 2 or possibly even 1 might have a good immune activity. But the standard recommendation would be, as it was FDA approved, 3 doses. So the age at which the FDA has approved the vaccine for HPV is between age 9 and 26. But the current recommendation for both girls and boys is early, usually between age 10 and 12. And the reason for that is HPV is a virus that is transmitted through sexual activity, and it's highly prevalent. Most adults in the United States, before the invention of these vaccines, have been exposed to the HPV virus. And so because it's out there so prevalent, if you're going to be effective, you want to vaccinate a person before they ever have exposure. So ideally, you want to vaccinate a girl or a boy before they have any sexual activity. It's really difficult to know at what age a son or daughter might have sexual activity, and that can be a difficult conversation. So we'd like to recommend the vaccine start well before it's likely that they will become sexually active. So the recommendation is between age 10 and 12. So what's really remarkable is there are a number of cancers that are directly caused by viruses. And there is another example of a virus that causes cancer for which we have a very active vaccine that is highly recommended for children. and that's the hepatitis B virus and hepatitis V vaccines. Hepatitis B virus can be the cause of liver cancer, and hepatitis B infection can be prevented with childhood vaccination. One of the sensitive issues around the HPV vaccine is that the human papillomavirus is transmitted by sexual activity, and so receipt of the vaccine is timed to be before the onset of sexual activity. One of the concerns many parents have is that by having that vaccine, does that mean that their children are going to be more likely to be sexually active, maybe because they somehow feel protected against the types of diseases that they may have with sexual activity? This has actually been studied in thousands and thousands of patients. A large study that looked at insurance records took a look at over 20,000 children who'd gotten the vaccine and over 100,000 children who had not gotten the vaccine. And they looked at their insurance records to see how many of them had been prescribed contraceptives as a marker of sexual activity. They also looked at insurance records to see how many of them had been diagnosed with another sexually transmitted disease as a marker of sexual activity. And what they found was the children who had gotten the HPV vaccine had no increase in those markers of sexual activity. So again, we don't think that having the vaccine itself is somehow leading to earlier or more active sexual activity, and the target for the vaccine is to deliver it before sexual activity starts so that we can prevent infection and cancer risk from this virus.